So good morning, everyone. Today we're going to be talking about community engagement, and I've added and involvement because this is how some funders do refer to community engagement as community engagement and involvement. And for any of you who may have recently especially applied to NIHR, you'll probably be quite familiar with that terminology. So why am I talking about this? This is really part and parcel of a lot of the research that I have done for the last almost 12, 13 years because I use a lot of participatory research. And I'll be talking about that in several slides, but it is sort of an overarching methodology where you really have quite a lot of participant engagement in the entire research process to the point where you actually tend to refer to them as co-researchers. So it's a very, very different sort of mentality. So I've been doing that and integrating that into a lot of the work that I have done. And now it's just something that a lot of funders are very interested in. So we're going to talk about that today from a funder perspective, as well as just an overarching perspective. But just a sign point, as if you caught the tail end of what Susie and I were chatting about, there have been, this is part of a series of seminars, and so these will be available, as Susie said, on the CCR website at some point in the future. But if you did want to capture this particular recording, if you just go to the feed, the chat for this, you'll be able to find it here. And then Tagreed has the last seminar in this series coming up in September. So there's no seminar series during August. So today, I hope that you will walk away with an understanding of what community engagement and involvement is and what it is not, when it should be used, how to actually do it, and then critically, how to write key aspects of community engagement into proposals. Okay, so this is just a thought exercise. So in the chat, if you wouldn't mind, I'm going to walk you through an example, and if you wouldn't mind just putting the number or the numbers of which scenarios you feel are examples of community engagement. So the overarching scenario is that we're assuming a hypothetical intervention that's improving the use of electronic immunization records in 5 districts. So let's say that this is a new intervention, so it's just being used in those 5 districts with activities all the way across the referral level, so right from the primary care level up to referral teaching hospitals. And let's say that this is a country like Malawi. So I've listed a number of different activities here. So in the chat, I want you to take just a minute and think about which of these you feel represents an example of community engagement. And you can pick more than one. So the first one around carrying out focus group discussions with community members to understand their recent experiences of immunization services. The next one around hosting workshops with healthcare providers to understand how, from their perspective, the electronic immunization records could be improved, and then using this in design. Or having monthly meetings with a German company that's responsible for this immunization record platform, so the rollout, or relaying findings to decision makers in tailored policy briefs. So in the chat, nobody has written anything as of yet, I don't think. If you could just please take 30 seconds, no wrong answers, just I'm trying to get a sense of how you're all understanding community engagement. So we have all number 2, 1 and 2, 1, 2, 2, 1, 2, and 3. Interesting. Okay, 2, 1, and 2. Just give it a couple more seconds for a couple more votes. 1, 2, and 4, 1 and 2. Okay, so number 1, Helen, you're adding to your response. So in this example, it's a bit of a tricky example because technically I haven't given you enough information really about these. The one that I would say is probably decidedly not community engagement would be number 3. And you'll see why, because I do not believe that the German company that is supporting this, even though they're really instrumental in the intervention and they're very important to engage with, it is not what I would consider community engagement because they're not a community of interest. When we think about community engagement, they're not beneficiaries of this research in the context in which the research is being carried out. So I would say number 3 is not an example of community engagement. That's just some great background activity. Number 2 is most clearly what I would say constitutes community engagement. And number 1 and number 4 could be community engagement, depending on what the purpose of those types of activities are. And as you can see, number 4 is very, very passive. It's just around a dissemination. So I will be making the distinction throughout this presentation in terms of more active community engagement and passive community engagement. And hopefully this will be a little bit more clear. So what is community engagement? Very simply put, it's in the title. It is engaging communities in research. There's a lot of different names for this. I think historically this has been called public and patient involvement, or PPI, or public and patient engagement, or simply just public engagement. I think NIHR, as I've seen here, you can see it's bolded. Lots of funders want to see this. So NIHR is one that's really calling for this to be embedded in proposals. MRC and Wellcome refer to public engagement, and they tend to sort of phrase it as a way of making science accessible, as a way of, relaying research findings and things like that to maybe lay members of the community or just to different stakeholders. So community engagement and involvement can be done by research teams, it can be done by institutions, it can actually be done by governments. It's really just whoever is leading this type of research who is actually going to carry out those types of activities. So in a very hideous way, for those of you who care about formatting, I've just added some little publications here that I recommend you check out. So this publication that's right beside can be done by institutions. It's about community engagement that's being done by the KEMRI Wellcome Trust Institute in Kenya. So this is back in 2008 that they published this, but they recognized very clearly that this institution, KEMRI, as a research institution, was situated, and there were about 250,000 people in the surrounding community who were often participating in research, who were often, certainly liaising with the institution, and they were maybe not aware of what the institution was actually doing. So they had quite a lot of community engagement that was really around just letting community members know what was going on at the institution, getting some of their feedback about what could be done at the institution, and setting priorities and things like that, which is really, really interesting to see. So this other second little teeny tiny reference that I have here is around, so this is specific guidance that NIHR now has. So this is written by a woman who you can see very clearly, she does quite a lot of participatory research, and she talks a lot about power and hierarchies and things like that. My caveat to this discussion, I'm not going to spend a lot of time talking about power. It's really, really important, but it's a huge topic, and it's not one that we can spend a lot of time on. It's also really complex to try to unpack. So just to note that this is a really, really useful guide, and I think it does ask some really important questions that help you to sort of interrogate the power dynamics within your research team, between your research team and the community members that you're seeking to engage, and so on. So please do have a look at that guidance. And actually in a couple of slides, I have a direct link to it. So what then distinguishes community engagement and involvement from something that's just community-based, or just from what we kind of have historically called public engagement? So as I was sort of alluding to before, really critically, it centers the beneficiaries of the research within research processes. So research processes, starting right from the get-go, starting from problem prioritization, starting from intervention design, all the way through to dissemination, actively engaging community members in that. So there are active and passive forms of community engagement. Active forms of community engagement are ways of putting beneficiaries in the driver's seat. So they're actively making decisions. They're actively playing a part in the research process. Passive tends to be more one way. So it tends to be around disseminating information, or maybe hosting a sensitization event, like a community event that's made to raise awareness about whatever the topic of the research is that you're doing, for example. So, but usually, if we're thinking about the research process, proximity is really important. So the closer that a beneficiary is to the activities of, whether it's an intervention, a program, a campaign, whatever it might be, the more active their involvement should be. The more distal they are, the more passive it can be. I'm really sorry, something is just making a noise on my computer, so I just have to shut it. So it's really important to be mindful of who your communities are. And I guarantee in almost every research project, there are multiple communities that you will have to think about engaging, very likely in different ways. And I'll be coming back to this. So what is a community? And this is a really obviously very central question when we're thinking about community engagement and involvement. So considering our electronic immunization record example, who do you think are the community members? So take just a minute, and again, if you could please pop this in the chat, who are the community members? So thinking about that example, you're thinking about electronic immunization records across, 5 districts in Malawi, being used in, health facilities all the way from the primary up to the referral levels. Yeah, who are the communities in that? And there's really no wrong answers here. Be brave. Nobody's putting anything in the chat yet. Okay, healthcare providers, patients. Yeah, health facility workers involved in immunization intervention delivery. Yep, healthcare workers, patients, beneficiaries, community leaders. Yeah, who else? Think broadly. Maybe if I asked you who are the stakeholders in this example, would you think about perhaps different people, different groups of people? So who are the stakeholders? Policymakers, yeah. Ministry of Health, yeah, you bet. Local health management, definitely, yeah, yeah. So it's useful to think about this in terms of, okay, who is responsible for, so maybe this is like a tablet that's being used to collect immunization data. Where does that data go? Who sees that data? Who uses that data? Who might have a vested interest in that data? How is that data then being used? Is it being used for resource allocation? Is it being used to provide more personalized and patient-centered care? Is it being used to support continuity of care so that if, say there was a child that was moving between any of those 5 districts, because that electronic immunization record was present, he or she could get, good continuity of care because it would be very clear what vaccinations they need from, this electronic data. And how does that then feed in at the district level, at the national level? So yes, people are definitely, everyone benefits directly, except the financing agency. I would say talking about benefiting directly is a bit tricky because in general, you might not always see direct benefits. I think there's direct and indirect benefits. And this kind of comes back to what I was saying about proximity to the research. So you'll see this more clearly in the next couple slides. I just wanted to touch, someone had suggested IT company or whoever has developed the system. They're definitely an important stakeholder. So yes, I for sure tricked you when I used the word stakeholder. But I would not say that they are necessarily community members in this because they are not beneficiaries of the research within the context in which the research is taking place. So it's really important to understand that community does not necessarily mean like a physical place of residence. Whenever people think of community, the first thing that our brains often do is you think about like a village, or you think about a city, or you think about a neighborhood within a city or something like that. You often think about a place of residence. And that absolutely can be a community, of course, and then there will be community members within that community. But it's often, if you think just merely about a group of people with shared interests and values, that can be a community. So overwhelmingly, beneficiaries who are actually situated in the context where the work is expected to deliver benefits are the community members that you should be thinking about. And as I mentioned multiple times now, some people are closer to those research processes and they are closer to having those direct benefits, and some people are more distal to that. So in this example, I would say for sure the health facility staff across all levels of the health system are definitely a community that you want to engage with. District health managers, or however the health system that you are interested in or the work that you're doing, however that health system is organized, these people should be reflected. So people that have sort of a decision-making role, people that will use the data in this particular instance. District data managers. So again, this might not be the correct terminology from allowing my apologies, but the people that are going to be responsible for ensuring that data, for example, get into health management information systems. So they're the people that are going to be interested in this data and how it can be used, ideally at a higher level. And of course, Ministry of Health representatives, definitely, because Ministry of Health representatives should be interested in what's going on in the health system across the entire country, and definitely users of immunization services. And of course, there can be others. If I was to sit down and really think about this, I'm sure that I would identify other community members. So I think a tricky thing can be understanding sometimes who the communities are, especially where the boundaries might be gray. So we're thinking of users of immunization services. So say there are some people who live maybe on a border between two districts, and one of the districts has the intervention, one of the districts doesn't. Does it mean that if they live there that they wouldn't be considered a community member because they may or may not access the intervention? So that's something about like a physical boundary. But you might also think, okay, so is everybody in the district health management team in this particular district going to be interested in this? Or do they have to have a direct role in immunization or electronic health records? So sometimes it can be very tricky to figure out who your actual communities are. So it does require a lot of thinking. And it does require a lot of thinking sometimes with community members to help identify who other community members might be. The other thing that is incredibly tricky is that you are going to have probably a diverse range of communities and community members reflected, and they probably have a diverse range of interests. So how are you going to manage the interests of all community members is a really important question to ask. So this is what I was saying in terms of proximity to the research. So again, using this electronic immunization record example, I would say healthcare workers who are using the electronic immunization records, they are inputting data into them, they're really the ones who are driving this, are obviously very, very close to this. Likewise, I think data managers are very close to this as well, because they're the ones who have a vested interest in taking that data, collating it, using it, feeding it to various people so that it can be used for resource allocation or decision making, whatever it might be. And users of immunization services are also quite close to the research process, I would say. And certainly in terms of being direct beneficiaries, hopefully this would enable better, more effective, more personalized treatment and care for people who are using immunization services. Then we, of course, get into district health managers. Depending on how the health system is organized, some district health managers have a lot of power, a lot of decision making if the health system is very decentralized. So they might be sort of the head honchos in terms of decision making. So definitely they're people that you need to be engaging with and recognizing them as a community of interest. And certainly Ministry of Health officials, if you do want anything to be scaled up, if you want it to be taken up, or if you just want to ensure that this is a really fit for purpose intervention and it's addressing a very clear problem that is also prioritized by the Ministry of Health, then you have to get the Ministry of Health on board from the outset. And then I think there's a lot of health interventions that, if they were successful, would have sort of more indirect benefits. So if this immunization, electronic immunization record intervention, say, takes off, maybe it paves a platform for just electronic health records more generally. So then maybe this is something that starts to improve the efficiency, resource allocation, continuity of care for users of health services more broadly. But I've put them here as being the most distal. So sorry, I should have said this side, the left side for me is the closest. So they're more proximal. I'm moving on to sort of the more distal. So I'd say they're the most distal community group to think of. So how might you then engage them? Well, I would say healthcare workers and data managers really need to be involved right from the outset in designing this electronic immunization record, because they're the ones who are going to be using it. It really needs to be fit for purpose. It needs to be something that is quick, accessible, easy, very usable by them. So the other way that you might want to involve them is certainly getting regular feedback. So getting regular feedback about how this tool is working. Does it need to be amended? Are there glitches? Those types of things. Really, really important to engage them in that respect. And certainly, if you did perhaps want to say scale something up or have this, being sustained, you might have like a training of trainers model and things like that. So do they need to be then involved if this is something that wanted to be scaled up? So thinking about that and involving them in that respect. So then we have users of immunization services, and it's not just a matter of doing some sensitization to say it's important to get your children immunized. It's much more about, okay, what are the implications for this particular community in terms of something like electronic immunization records? And how can we ensure that we're maximizing benefits in this community and that we're minimizing harms? So maybe something like determining what is generally understood about health records and electronic immunization records to get a sense of, what do they understand about these? And certainly things like, do they understand consent and data sharing? Do they understand what data is being stored, where that data goes, how that data is used? And then actually taking some of those insights and then building that potentially into some sensitization activities that are then actually part of the intervention. So you can really use a lot of qualitative methods to do this. So to gain those insights, you might use, say, focus group discussions, you might use in-depth interviews, and then to have maybe some sensitization, you can do maybe some workshops with broader community members and things like that. And you'll notice that I have pretty much the exact same thing here in terms of how you might engage these particular community members. Likewise, I think district health managers and Ministry of Health officials should be involved at the design stage, because this needs to align with broader systems. So you don't want to create a parallel system. You don't want to create a system that's totally not complementary to everything else that's going on. So you really want to ensure that you can have these people involved. And I've also added here that you could maybe involve them perhaps in meetings. So again, when I was talking about a very decentralized health system, the buck kind of stops at district health managers to an extent. They make a lot of the decisions for what's going on in that district. So maybe Ministry of Health officials, it's a little bit more one way, a little bit more passive. You're more or less just disseminating things to them, keeping them involved, keeping them in the loop, so to speak. So maybe you're just hosting a series of meetings in order to do that. And then finally, and I've put them in red here, excuse me, users of health services more broadly, maybe this is just where you have a little bit more passive, more one-way electronic immunization record sensitization, just to increase people's knowledge and understanding of what this is and how they might benefit from it. And there's a million ways that you can do this. So I've just listed a few posters. You can use media, maybe you're using radio, maybe you're using social media, you're using television, who knows, a community event. There's lots of different ways that you can do that. So this is by no means exhaustive. All the things that I was just mentioning, that's just the tip of the iceberg. There's a million ways that you can engage communities. Other ways that you might choose to engage communities, having them actually in place as a steering committee member or a community advisory group or a community advisory board or just an advisory committee. There's obviously lots of different names for those types of things. But the key here is that those community members that are sitting on those committees, let's say, or those boards, are actually in a position where they can influence the study or the intervention of the program or whatever it is meaningfully. So they can actually input into the study design or the progress of the study, and they actually have the opportunity to make decisions. So it's not just that they give feedback and they make suggestions, and then the researchers say, yeah, no thanks. It's actually saying, okay, well, you're making suggestions. Even if I disagree with this, I have to really consider this, and I have to think about how this might be integrated into the work. So as I was mentioning before, I do a lot of participatory research. Participatory research necessarily involves participants and communities in the whole research process, ideally, right from start to finish, in terms of priority setting and problem identification, all the way to thinking about what is going to be implemented, thinking about how that can be evaluated. You often engage community members in collecting data, in analyzing data. It's often done collectively. And certainly community members are involved in dissemination. So depending on the type of research that you're doing, the intervention, the methodology that you're using may itself already very much lend itself to being community-led. And that obviously is a very good example of community engagement because it's just intrinsic to the research that you're doing. Certainly, if you have a little bit more of the passive types of community engagement, you might have meetings, discussion forums, and really any form of public engagement that can be one way, a bit more passive. Another really, really good thing to do is to actually have community members on the study team. So for example, we're working on a proposal right now where we're looking at improving some things around quality improvement and postpartum hemorrhage and things like that in Ghana. And on our study team is a woman in Ghana Health Services, and she has a distinct role for both uh, developing and implementing the quality improvement policies in Ghana. So she's a really important stakeholder. And then through her, we have links to that community of stakeholders within Ghana Health Services who support the policy development and implementation around quality improvement. And this is exactly what our intervention is trying to improve. We're trying to improve the policies and the implementation of quality improvement in Ghana for postpartum hemorrhage. So she is on our study team right from the outset, right from the proposal stage. She's been inputting into this, and it's been enormously valuable to have those insights. So if it's possible, it's really good to have community members on the study team. Anything, I think, really that enables a study team to connect with beneficiaries in such a way that they have influence across the research process can be considered community engagement and involvement. So this is certainly not limited. You can get creative with this, definitely. So this is what I was talking about. This is the actual link to that guidance that is really used by NIHR right now. And it is all about meaningful community engagement and involvement in global health research. And so it's just a short, snappy document. It's just 6 pages, but I think it offers a lot of really important questions that enable you to reflect about how you will do community engagement with the best possible outcomes. So this was really around when you're actually doing community engagement, what are some of the key questions that you would ask? So this is on, I believe, 4 pages, or sorry, page 4 of this guidance. You can definitely find it. And I just wanted to go through some of these questions and kind of highlight some key bits of them. So how will you put proposed research questions and later research findings into formats that are community accessible? Do you have the skills within your group to do that, or do you need to allocate funds for community-based expertise? So a really important aspect of community engagement and involvement is that you're speaking the same language, that you're able to actually, reach common ground. So if the community that you're engaging with maybe doesn't have the insight around, very technical language or jargon-filled language, there might have to be quite a lot of investment right from the outset in terms of just communicating to that community and making sure that you can get on that same page. So it's really important to think very, very carefully about how you'll communicate different aspects of the research process and really meaningfully engage people in that process. They have to understand what's going on in order to meaningfully engage. So how will you create the necessary flexibility and potential for adaptation within the project so that the results of community engagement and involvement are incorporated or even potentially used to change course? I am very much of the opinion that they should be used to change course, but I also do implementation research where absolutely that's part and parcel of what you do. You adapt what you're doing with community member insights so that at the end of the day, you have something that's very much fit for purpose and tailored to a context. If you're doing an RCT, that might not be an option. If you have a very distinct intervention and you're trying to, keep that unchanged and fixed so that you can compare it and figure out what that intervention is actually doing within your population of interest, then you might not have that flexibility. It's definitely, I'm not saying that you cannot do community engagement and involvement in RCTs. You definitely can and you definitely should. But in terms of actually adapting an intervention as you go, it might not be quite as possible. So going back to what I was saying around having a diverse group of community members with diverse interests that you're going to try to obviously meet those interests. How will diverse types of knowledge be accounted for within the research process? That's question number 3. And then number 4, have you built in mechanisms to acknowledge and engage with dissent or alternative views within the community engagement and involvement process? So I think it's really important just to recognize that if, for example, we're talking about community members, as in people who are living in a community, who are maybe users of, say, a health service, they might be engaging with Indigenous knowledge systems. They may be engaging with traditional medicine. They may have very, very different beliefs around health and wellness and whatever the topic of interest is than, say, healthcare providers, and certainly than, say, somebody from a ministry. So it's really important to think about how you will navigate these different types of knowledge and make space for different types of knowledge. So a lot of it, I think, comes down to very careful facilitation and choosing how you engage very wisely. So number 5, how will you manage different approaches to research and community engagement and involvement within the research consortia itself? Are there plans to surface implicit biases of team members or to address honestly as a group the challenging power dynamics that can result from diverse disciplinary allegiances? So this is, I think, really important, actually interrogating as a study team, how will you manage your own differences and thoughts about how to do community engagement and involvement? Because very likely there's going to be some different perspectives around that. Somebody who is a biostatistician who overwhelmingly leads clinical trials is probably going to have a really different perspective to someone like me who does participatory research. So really thinking about how do you come to sort of a happy medium and make sure that you can do this effectively on your research team. And then finally, when considering the proposed research, ask yourself, whose knowledge counts most? Then ask yourself, what can be done to shift that dynamic so that this research draws on and generates knowledge that reflects more fully the lived experiences and needs of marginalized and vulnerable groups? So keep in mind, this is guidance around global health research, and a lot of global health research emphasizes marginalized and vulnerable groups. So it is really, really important. This kind of comes back to what I was saying earlier around power that I was not going to explore in detail, but thinking about who does not have power within the communities that you're seeking to engage. And in engaging them in research processes, that shifts that power dynamic a bit. And so it's really, really important to think about prioritizing those, I would say, historically disadvantaged and marginalized voices and really bring them to the fore, especially if they are supposed to be the direct beneficiaries of your research. Really, really important to think about doing that. So why engage people along the research process? I think it makes it infinitely better and more useful, and then you don't necessarily have the issue of, you know, somebody coming in from country X into country Y thinking they have some solutions for country Y and that they can make everything better in country Y, when really they have absolutely very little insights around what's happening in country Y. So you absolutely must engage with community members. Also, I would argue the more that you engage community members, the more they can take ownership of different aspects of the research process, the more likely you are to have a sustainable intervention or whatever it is at the end of the day. Because if community members can actually take that on, that's kind of the end goal. It's not just introducing something, finding out if it works or not, and then walking away and really never actually seeing some overarching benefit and sustaining benefit to that work. So this is just a very sort of distilled down, snippets of the research process. But if we think about right from the outset, problem prioritization and intervention design, if you actually engage community members and you get their insights around what is a problem, what should this intervention look like, it really ensures that interventions are fit for purpose and they're addressing problems that stakeholders actually agree is a problem. We think about then intervention implementation. As I said, you may have less flexibility to do this depending on your study design, but if you're doing qualitative research, if you're doing implementation research, if you're doing participatory research, definitely I think you have scope to really have ongoing feedback mechanisms to refine what's being implemented and to, again, make this a lot more sort of optimized and fit for purpose. That I think, again, ensures sustainability because at the end of the day, it's going to be something that hopefully really can be readily taken up. In terms of data collection, not only is it very useful to get insights from community members to say, how can we ask some of these questions in the best way? How can we, actually do this? So they can be involved in designing data collection instruments. Also, sometimes they participate in the data collection itself. So this is particularly true if you, say, have a very hard to reach marginalized or vulnerable population that you're working with. You may have community members from that population who you can access, who may then actually play a role in carrying out data collection within that population. And then in terms of data analysis, I think it's always really, really critical just to reflect on findings with, I use the word stakeholders here, but community members. Asking them to explain findings from their perspective. Maybe if you have some findings as you're going along or you have some data that you're struggling to make sense with, pose it back to community members and ask, what do you make of this? What do you think is going on here? And certainly a lot of qualitative researchers will regularly carry out member checking where you present your findings and basically ask, have we got it right? And I think that's not just limited to qualitative research. I think that's a really good way to engage community members to ensure that your analysis has been done properly. And then finally, in terms of dissemination, I think stakeholders can provide really fantastic insights around how to best communicate to community members across those varied communities that you might be interested in communicating to. How to engage, this, as I said, is completely non-exhaustive. You can use qualitative methods if you're trying to explore things a bit more. You can have meetings, you can have discussions, you can have workshops. And I do recommend, actually, and certainly please get in touch with me if you're interested in this a bit more, but participatory research, participatory action research, it has many, many different names and different ways to do it, has loads of different tools that are used to kind of do all of these things, basically. So sometimes mapping exercises, which are often visual exercises, where, for example, if you're trying to understand a problem, you might map a physical space and sort of identify roots of problems and things like that. There's lots of visual exercise and things like that that can be used that are very participatory, that can be used in sort of doing some of these types of things. So do look to participatory research and the methods that are embedded in that type of research, I think, for some cues to how you might do this more effectively. So writing community engagement into proposals. From the outset, you need to really define your community or your communities and how you will access them. So if you are talking about, say, a rural village, how are you going to get access to that village? You can't just march in and say, hi, I'm from the Liverpool School of Tropical Medicine. We want to do a study here. You absolutely have to work with community gatekeepers. You have to understand the context. So certainly, showing that you're aware of who those community gatekeepers are and ensuring that you can actually build time into accessing a community and building trust in that community is really integral. It's also very useful if you wanted to write this into a proposal to indicate, if there has been, can I go back that way? I can. If there has been prior community engagement that this study actually builds from, because that shows that you have a history of doing this, and it's not just tokenistic. You're not just doing it because the funder has told you to. It's something that actually has been part and parcel of the research that you've done, before even getting to this point. I think then it's really important to define the parts of the research process that communities will be engaged in and how, and provide details here. Which platform? Are you going to use workshops? Are you going to do some focus group discussions? How are you going to engage them? How often? And to what end? What is going to be sort of the outcome of however that engagement has happened? What is the outcome of that? How will that actually be used? So thinking about that and making that very explicit is key. You also want to earmark funds for community engagement and make that explicit. Tell them this is the amount of money that we have in our budget that's actually going to facilitate these community engagement and involvement processes. And have actual people on the study team responsible for community engagement and ensure that they have allocated time and resources to do community engagement and involvement. So these people should be sort of close to communities at all times so that you can maintain consistency, so that you can maintain whatever relationships are being built. Because a lot of community engagement and involvement is really about relationship building at the end of the day. So making sure that those relationships can be sustained and having people that will sustain those relationships is really important. And then finally, as I alluded to before, having community members actually on your study team and writing your proposals with you, and making it very clear to the funder who they are and what their role is, I think is really, really a big asset. So I think the bottom line is that you want to avoid tokenistic sort of community participation or community engagement. You don't just want to be doing something in a community and considering that community engagement. It's not. Remember what I was saying about having more active engagement. So certainly if you're doing work in a community, those community members should be very actively engaged in the work that you're doing. So you also, of course, want to avoid extractive practices that benefit researchers more than they benefit community members. And I think community engagement helps to avoid that. Community engagement helps to maximize the benefits of research. And if it is very tokenistic, I think it's pretty obvious to a researcher, to a reviewer reading proposals that it is quite tokenistic and you've not really thought about this. This is not something that is actually quite important to the study team. So I have sat on some of the panels for NIHR as their community engagement and involvement sort of expert, looking specifically at how each and every proposal is writing this into the work that they're doing. And it is very clear where the study teams have gotten a good handle of this, and they've really made a lot of effort to do this, to the greatest extent possible with the highest level of quality, and where they just see it as sort of a tick box exercise. So some pro tips in terms of, this is not an extensive list, but I think in terms of doing community engagement and involvement well, these are a few things to think about. So do think about this from the outset and do write it into proposals, ideally with community members, ideally with them, on your study team. Do ensure that there are resources, people, money, materials, time for community engagement and involvement. This shouldn't be an add-on, because if it is an add-on or it's just something that you're wedging into pre-existing activities, it probably won't happen. Or if it does happen, it's probably not going to be very good. So do take time for sure to build trust and to understand and navigate power dynamics within the community, within your research team, and between communities and your research team. Clear communication is really key, and transparency. So being very clear about what expectations of all parties are and how that can be managed is really, really important. And as I was saying before, you might need some communication activities just from the outset that are really around sort of demystifying technical language. You might have to invest in capacity strengthening. So you might have to have some time, maybe 3 to 6 months, before you even really get into the nitty-gritty of involving community members in the research process to get them to a place where they can be meaningfully engaged in the research process. And as I just said, community engagement does need to be consistent. So really important to have some study team members who are always sort of close to communities to the greatest extent possible. And then you want to keep track. So there's like sort of the process indicators and measures of community engagement and involvement. What did you do? How often, with whom, like how many people showed up, how many people did you engage with? But I've bolded the most important bit. What was decided or what was done, and how did this inform or change the research process? So how was this actually integrated into the research? And you can report this back to community members to show we are taking this on board. We are taking your inputs very seriously. And I think you can also have a little bit more of a qualitative exploration around, did community members like this? How did they perceive their role? How did they perceive what they did and what their contribution was? And I think these sort of qualitative insights can also be very useful in terms of evaluating, so to speak, your community engagement and involvement processes. Okay, so the sort of last part of this presentation, there were a number of questions that were submitted before the seminar, so I'm going to answer them now, and then we'll have some time for just questions, again, just open questions that may have resulted after this presentation. So if you can save your questions, those ones, right to the end, we will get to them. And I do have a couple sort of questions about the questions, mainly just one. So if you're the person who asked that question and you're here, you'll see what I mean. So questions answered. How to start it. I hope this has been made clear. You have to identify your communities. You have to identify your gatekeepers. You have to think about the best platforms to engage them. You have to think about how you want to involve community members in different aspects of the research process and how you're going to do this meaningfully. So you really need to kind of sit down and just lay it all out from the outset. How to penetrate a difficult community. I don't think any community is necessarily difficult. I think some communities are difficult to penetrate. But I think what I was saying before around community gatekeepers, if you do already have maybe a relationship with some members of that community, utilizing that, definitely taking time to gain entry to a community, taking time to build trust. Those are really important ways of sort of penetrating a community that is difficult to gain entry into. How best can community engagement be done to improve health system strengthening? So again, I've provided in a hideously formatted way a little paper there to look at because it nods to this. But I think community engagement is an essential part of health system strengthening because you have to reflect so communities can be users, healthcare providers, managers, many people, as we've already talked about. Those are all really key health systems actors. So understanding what healthcare actors need, how you can support them is really key in terms of health system strengthening. So definitely, I think community engagement, how best can it be done? I think, again, you have to identify who your communities are. And obviously, health system strengthening is huge. So you have to really think about what aspects of the health system are you going to aim to strengthen? Who are the community members that you're interested in working with in that particular respect? Because they obviously have a particular involvement in whatever processes or systems that you're interested in. And then thinking about what their needs are, what their priorities are, and how you can strengthen things with them. So community engagement involvement on injury prevention, care, quality improvement, and disability prevention. I have absolutely no background whatsoever in injury prevention or disability prevention. So I'm very sorry I can't speak to that. I would just sort of echo what I'd been saying previously around sort of following those steps. Identify your community, identify your gatekeepers, make time to build trust, think about the platforms to engage, and so on and so forth. On care quality improvement, if you're talking specifically about quality improvement processes, i.e., when you're engaging stakeholders who are involved in processes, say, of care, to identify problems in that care, and then to come together to collectively create and implement solutions to that care, then I would say that those types of quality improvement processes, again, are intrinsically about community engagement and involvement, because it is involving those community members in identifying problems and responding to those problems. So again, some methods themselves will necessarily just lend themselves to community engagement and involvement. The role of behavior change communication in community engagement. I wasn't too sure what was meant by this question, whether you need to have behavioral change communication to do community engagement, or whether community members might be involved in supporting good behavioral change communication. So on the former, I think it goes back to what I was saying before about getting community members to a place where they can meaningfully engage may indeed require some type of sensitization, may require some, as we talked about, demystifying of scientific and technical language. It may require some capacity strengthening. So that's one way that you may perhaps involve behavioral change communication, to sort of capacitate community members to meaningfully engage. But if you are doing a behavioral change communication intervention, definitely community members are very, very important to engage with, because they will definitely help you put things in a language that can be readily taken up by whomever it is that you're targeting through that behavioral change communication. The role of a dynamic and effective community advisory board. I already talked about this. I think they are fantastically useful if they're in a position where they can actually make decisions. So if they're just sort of giving feedback that can be ignored by researchers, less effective. So if you have an active community advisory board with power, then I think that can be a really, really useful tool. Types of community engagement, we talked about this already, so I hope that's been sufficiently answered. If not, feel free to ask again. How can we measure the success of community engagement? This goes back to what I was talking about in terms of keeping track. So measuring processes of community engagement, what it actually achieved, how it influenced the research process, and then actually going back to who you engaged with and getting a sense of how they understood that process, what they benefited from, how they perceived their role, and so on and so forth. All those are ways, I think, to measure the success of community engagement. And then, so this is actually two questions, but I've kind of collapsed them into one. How can we mobilize individuals with lived experience who have become physically disabled as a result of unintentional injury? And how do we deal with vulnerable populations? I collapsed them into one because I think my response to both these questions is the same. If you're talking about a very vulnerable population, I think it's very useful to bring the research to them rather than asking them to come to the research. So certainly, really taking time to build trust, really, again, using those community gatekeepers so you can access these individuals, but then making it as easy as possible for vulnerable populations, for people who may be physically disabled, who are physically have access barriers, ensuring that you can help to overcome those barriers by bringing the research processes as close to those individuals as possible, is what I would say. So maybe you have your meetings in a community, maybe you have them very close to where individuals with disabilities are able to access, something like that. But thinking very carefully about how you can make things easier for them to be involved in the research processes is very, very key. How to stay engaged with overseas partners and community when working from home or not being able to travel. This goes back to what I was saying, having people on your study team who are very close to those communities at all times is really, really key. I am passionate about community engagement and involvement, but in all the work that I do, I am not really the person who is leading 99.9% of it because I am sitting in Liverpool. It is tricky. You really have to be there physically present often to make this work, but you can certainly understand what's going on. You can obviously provide insights. You can sort of, just get a sense of how community engagement and involvement is happening and feed into those processes that is ultimately led by people who are actually physically situated there. And if possible, depending on who your communities are, however, say they're from the Ministry of Health, maybe it's very easy for them to actually use Zoom or Teams or something like that. So maybe you can actually do a little bit of community engagement and involvement virtually, digitally. So that's always a possibility as well, depending on who your community members are. Identify who we engage, how and where. This depends very much on your research questions, your objectives, the intervention that you want to do, whatever it is. Identifying who your beneficiaries are and who stakeholders more broadly are will help you, I think, pinpoint specifically who your communities are. So kind of doing an exercise like we did many slides ago, where I just asked you, who are the community members here? Just really thinking about that. And then in terms of how to engage them, I would start by actually talking to community members and getting a sense of how you might best engage with community members. And certainly working really close with contacts in country, working closely with members of a study team who are based in country, who know the context, who speak local languages, everything like that is really, really, really important. How can you engage communities in research data analysis? So that is something that absolutely, I already talked about, but basically just presenting findings and saying, have we got this right? Or presenting some data, and especially this can be done, I think, with qualitative data, presenting some data and saying, how do we make sense of this? What do you make of this? So that is a way that you can certainly involve them in research data analysis. So look up member checking in sort of qualitative research, and I think that'll give you some insights around how this is sort of often done in qualitative research, at least. And then the last question I bolded because I didn't understand it at all. How can social media be incorporated into research settings without ethical violation? I have no idea what this is talking about, especially in terms of community engagement and involvement. So if you ask this question, feel free to illuminate. But otherwise, I will turn it to you. If you have further questions after questions, or you want access to resources or anything like that, if you want me to recommend anything, this is my email address. So please get in touch. And then over to you if you have any further questions.